In this video, I'm going to give you 5 reasons why Medicare Supplement Plan G is my favorite plan. Number 1, no prior authorizations. Number 2, no referrals. Number 3, no networks. Number 4, no benefit changes. And number 5, no disputes with CMS or the federal government. In this video, I'm going to break down what those 5 things mean and how they affect you as a Medicare beneficiary. Thanks for tuning in. I'm Mark Prip. I've been a licensed agent since 2003, exclusively working with folks select the right Medicare plan. So today what I want to do is give you some highlights and reviews on the Medicare Supplement Plan G and why I think it is one of the best plans to enroll in. I'm going to do a quick overview. I'm going to talk about coverage, cost, Plan G versus Plan N, Plan G versus a Medicare Advantage plan, and then provide you with some review data on customer satisfaction for those that are currently on Medicare Supplement Plan G. So jumping right into the review or the overview, Plan G offers extensive coverage and the freedom to choose any network provider. Plan G is the most popular Medigap plan today, with over 3.5 million people enrolled. Some of the key features of Plan G is that the benefits are consistent year after year. Plan G is standardized. That means any insurance company that offers it is required to offer the same Plan G benefits. There are no network limitations or referrals, and it boasts lower premiums compared to that of Plan F, and it's offered by probably over 90% of Medigap providers in the country. As long as you pay your premiums on time, your Plan G policy is guaranteed for life. So let's jump right into the benefits and see what this plan looks like in terms of the costs that you're responsible for versus the cost that's covered by Original Medicare. So right out of the gate, you can see anything associated with Medicare Part A, you as the member experience a zero copay. When it comes to Medicare Part B, it covers 100% after you pay a $240 annual deductible. That would be like things like outpatient testing or office visits. Part A hospice care coinsurance or copayment is zero. Skilled nursing facility care is zero. It also provides an extra 365 days of hospital care after the original Medicare lifetime reserves have been used. Doctor office visits are a zero copay. Hospitalization and skilled nursing care, also a zero copay. Skilled nursing facility, zero copay for coinsurance for up to the first 100 days. And there is a foreign travel emergency benefit. Beneficiaries receive 80% coverage for emergency care outside of the United States or its territories. Plan G has a lifetime maximum of $50,000 for foreign travel emergency care after a $250 deductible. How much does Plan G cost? In 2024, the average monthly cost of Plan G will fall between $110 to $180 a month. It's important to note that the monthly premium for Plan G can vary depending on the state. Okay, so the cost of Plan G can vary based on location, age, gender, and tobacco use. I recommend you consider these factors and compare rates among different insurance companies so you can find the most affordable, suitable Plan G coverage. Now, what is not covered by Plan G is going to be, as I mentioned before, the Part B deductible. You'll be responsible for that first $240 on your outpatient care per calendar year. Plan G will cover Part B excess charges. The other thing that it will not cover is pharmacy or RX benefits. So you would need to consider enrolling in a separate prescription drug plan. Now the difference between Plan G and Plan N, I say Plan N because Plan N is definitely the second most popular plan when compared to Plan G. So they are very, very similar. Medigap Plan G offers coverage for Part B excess charges, while Medigap Plan N does not. Plan N requires you to pay co-pays or co-insurance for certain services, such as doctor and emergency room visits, while Plan G covers 100% of these areas. So let me jump back to the excess charges. So that means that a doctor is allowed to charge upwards of 15% above the Medicare allowance. When you're on the Plan G, it will pay that for you. If you're on Plan N, those excess charges for Part B would not be covered. Those would be your responsibility. So now Medigap Plan G versus Advantage. This is probably the most important part in this video that I want you to pay really close attention to, because as I'm sure you're fully aware, the two most common avenues for folks on Medicare is going to be a Medicare Supplement, which most of the time is Medicare Supplement Plan G, or a Medicare Advantage plan. The two operate very, very differently. So let's start with Medigap. Probably the single most important factor is that Medigap Plan G does not require prior authorizations. If you're taken to the hospital and it's an urgent matter, a prior authorization means the insurance company has to be notified about the recommended procedure by the facility or the doctor or hospital, and then the Medicare Advantage company can deny that prior authorization request, or they can approve it. Now, let me go one step further with that. In a study done by the Kaiser Family Foundation in 2021, more than 35 million Medicare Advantage prior authorization requests were processed, and over 11 million were denied. Let's say you're experiencing chest pain, you go to the emergency room, they're going to run you through a stress test, some lab work, and then maybe do a heart catheterization. So every one of those steps, the Medicare Advantage plan could require prior authorization, meaning they won't go through with the procedure until that prior authorization is approved. That could be minutes, that could be approved in hours or days. Medigap plans, it doesn't matter which Medigap plan you have, no prior authorizations. That means your care can continue quickly without any middlemen deciding whether that procedure is going to be approved or not. The next big thing in my mind is no referrals. You do not have referrals, nor do you have to work inside of networks like an HMO or a PPO. You have the freedom to go wherever you want as long as original Medicare is accepted. Any Medicare supplement plan, including Plan G, was then automatically accepted by that provider. No benefit changes. So Medicare Advantage plans, there's potential that those change every calendar year. Maybe your copays go up. Maybe your pharmacy list changes. Maybe your premium goes up, or maybe you had a plan without a premium and now it has a premium. So Medicare Advantage, it has a greater potential for plan and benefit changes, where once you're enrolled on a Medigap Plan G, whatever your benefits are, they're locked in and they stay the same year over year over year. Okay? And last on my list is no CMS disputes. Because CMS, or the federal government, goes into contract with a Medicare Advantage company, every year CMS decides how much they're going to reimburse a Medicare Advantage plan company for your enrollment. So over the years, that amount is favorable and insurance companies are grateful and don't change anything. Other years, that amount can come down and CMS offers a lower reimbursement rate. That Medicare Advantage plan will now be pressed to figure out how to remain profitable, so they may squeeze your benefits, take away medications from the RX list, change the network. There's many ways to rein in the cost on Medicare Advantage. So when I say no CMS disputes, that's the beauty of Medigap Plan G. There are no reimbursement rates. There's no negotiating. It's very simple, very black and white. Original Medicare pays its bulk, which is generally 80% of the claims. Medigap Plan G comes in and pays the difference. There's no monies being exchanged from a Medigap company and CMS about enrollment. You simply pay your original Medicare A and B cost and your Medigap premium. They remain separate. There's no in-between reimbursement between the two. I've kind of touched on these, but on the Medicare Advantage, we talked about prior authorizations already. All Medicare Advantage plans require and are built behind prior authorizations. They also are going to have referrals. If you have a PPO, you'll deal with less referral, maybe none. But if you have a Medicare Advantage HMO, that has referrals. Everything you do outside of your primary, you have to get a referral for. So it's a much more managed care plan. Could look very similar to an employer-based plan that maybe you had in the past. Benefit changes. You will experience benefit changes on the Medicare Advantage plan. You may go 3 years without seeing any change, but as healthcare costs increase, they will manipulate the benefits to remain profitable and keep everyone happy. And last is the CMS disputes, as I mentioned in the Medigap. You will very easily be caught in the crosshairs if CMS does not increase the reimbursement to that company. The company's only option is to reduce your benefits or change the network to offset what they're not being paid by the federal government. I wanted to point out the strong Plan G reviews. So let's dive right into this. Now that Plan F is no longer available to new Medicare beneficiaries, Medigap Plan G has the highest enrollment among every available Medigap plan. More than half, 58% of beneficiaries turning 65 purchased Plan G. Medicare Plan G saw a remarkable 22% surge in enrollment compared to the previous year, attracting an additional 660,000 enrollees. Plan G clearly demonstrates the highest growth rate. In a study performed by AHIP, it reveals that people are satisfied with their Medicare supplement coverage. The findings were this: 93% of beneficiaries are satisfied with their Medicare supplement plan, 83% call their coverage good or excellent, 96% agree that Medigap coverage allows them to see trusted providers and specialists without worrying about out-of-pocket costs. And lastly, 77% of beneficiaries find the most valuable benefit to be the coverage of hospital expenses. My biggest thought on this is that with Medicare Advantage, the big print giveth and the fine print taketh away. And what I mean by that is, from the surface, a Medicare Advantage plan is very appealing because roughly 77% of Medicare Advantage plans have a 0 monthly premium. That's very appealing to a lot of people. And then they have co-pays for all the various services. You may pay $20 for a doctor, you may pay $70 for a specialist, you may pay $400 a day per hospital stay per day. So if you're going in for 3 days at $400, that $1,200 adds up pretty quickly. With Medigap Plan G, you start with a higher monthly premium. There are no co-pays. Any deductibles that Original Medicare has, the Medigap Plan G pays for outside of your Part B deductible, which is very small. It's only $240 per year. No provider disputes, no network changes, no referrals, no disputes between a provider and the insurance company or CMS. If you can afford Medigap Plan G, I highly, highly recommend it. If you have questions about either one, shoot me an email, give us a call, comment. Our job is to try to make the Medicare road easier because it's very complicated, as I'm sure you've seen. Thanks for watching.